For plants to grow and bloom, they need sun, water, and nutrients. Life and beauty built over time with certain requirements. Similarly, for those of us in medicine, there are certain needs and prerequisites to flourishing. Check out the rest of today's episode to learn more. Welcome to the Med Ed Well podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stejink, a practicing general pediatrician and online entrepreneur. Thank you so much for joining me here today on another episode of the Med Ed Well podcast. We're already to episode 22. Thank you so much for listening, for reviewing, and for sharing these episodes with other physicians and those in medicine. If you're looking to get home sooner, check out my free guide, Maximizing Your Clinical Efficiency, 10 Tips to Getting Home Faster. You can check out the link in the show notes. I look forward to sharing some of the things that I've learned and to hearing your feedback as you put these things into practice. Today we'll be talking about flourishing. What is it? What does it look like in medicine? And what are necessary, but not sufficient, prerequisites for that to happen? Before we get into the rest of today's episode, let's hear from today's sponsor. The White Coat Investor has been helping physicians and other high-income professionals with their finances since 2011. They have a series of courses that have CME available and are just really helpful in making a financial plan and moving forward with your goals. They also have things on physician wellness. I think they're really helpful. I've done the Fire Your Financial Advisor course, and I want you to know that you can get signed up at the link in the show notes. Check out a course today, especially if you have CME funds that are left to use by the end of the year. All right, now back to today's show. So Merriam-Webster defines the word flourish as follows: to grow well, to be healthy, or to be very successful and to do very well. Similarly, Maslow's hierarchy of needs includes physiological needs, safety, love and belonging, esteem, and self-actualization. A 2018 article by Shapiro and colleagues entitled Beyond Burnout, a physician wellness hierarchy designed to prioritize interventions at the systems level, adapted Maslow's hierarchy of needs to address physician burnout and wellness. It's not just an individual thing, it's also about addressing things at a system level. Additionally, Peggy Swarbrick put together the 8 dimensions of wellness, what we've seen as the wellness wheel. You may have seen adaptations of this, covering financial, occupational, and 6 other areas of wellness that overlap significantly with the personal, professional, and financial areas that I seek to cover in this podcast. So taking all that together, I want to touch on those 3 prerequisites for flourishing that fit into these hierarchies and domains of wellness. So the 3 areas: number 1, supporting health and fighting exhaustion. Number 2, belonging, connecting, and humanizing. Number 3, being able to contribute by doing meaningful work. So number 1, being able to support your own health as healthcare professionals and having a supportive environment and system. The first area to address is sleep. This can be really difficult at times for all of us, especially in training, rotating shifts, being on call, maybe having kids or other outside responsibilities. I'm working on it myself. I'm more of a morning person, but with a wife and daughter, time with them often means that I stay up a little bit later. So maybe not always able to get to sleep as early. But again, this is about intentionality, having family time, getting things done around the house, other responsibilities, and getting enough sleep. Institutionally, it's super important to support sleep, particularly in training. For me, as a third-year medical student, my pediatrics rotation was about a 45 to 50-minute drive through a large metropolitan city. On the way home one day, I was just passing a light when I had a microsleep. It was really scary. Thankfully, I stayed in my lane and didn't get in an accident. But then when I had my sub-internship at the same hospital, it would have been kind of a reverse commute, especially when I was doing my week of nights. I decided to actually stay at the hospital in the call rooms during the day for those nights because I was worried that I was going to fall asleep on the road home. I just didn't dress myself. And I was thankful for the space in the call rooms to be able to do that. Some residency programs have even started having ride-hailing services available as a perk post-call. I'm not sure that my program did, but they did have available call rooms. Though I had a shorter commute in residency, but after 28 hours, sometimes with minimal sleep in the middle, I would sleep for 2 to 3 hours after getting off from my shift and then call housekeeping on my way out to turn over the room for the next resident. So intentionality individually and in the environment and systems in which we work and live. It makes it easier if we have those supports from the system, whether it's healthy eating, if it's only junk food available in the cafeterias, it's going to be a lot harder to eat healthy. To exercise, whether it's having access to a workout area or showers and lockers at work, if you're able to ride your bike in, it's a variety of things. So, number one, it's important to have a supportive environment for health as a prerequisite for flourishing. But another one, number two, is opportunities to belong, to connect, and to feel like a human. Each season of training, and even after as an attending, has its own challenges for feeling that connection and community. For medical students, particularly first and second year, there can be a lot of solitary studying time. Maybe some groups, but even those can sometimes feel cliquey like in high school. Moving into third and fourth year, more clinical rotations, it can be all over the city, all over the state even, particularly with big medical school classes. And you may not even see colleagues on the different rotations as you're at different hospitals for quite some times. And you're also running around for interviews, particularly fourth year. By the time you get to residency, there's long hours, different rotations. You may get to see people at noon conference, but there may be limited time outside of work to be able to connect. As an attending, there's the daily grind of being the doctor, working through lunch, maybe a small clinic or group, or just the demands and the requirements, all those things that just kind of weigh on you. So we've all got challenges to connecting with others, to feeling like a human when so many of the aspects of training and attending life encourage you to put your head down and push on forward. So what can we do in these situations to promote flourishing in ourselves and in our colleagues? For medical students, it may be having a few people to sit with and lecture or to study with. It could be joining an organization or two about something that you're interested in. Notice I didn't say join 5 to 10 organizations just to pad your CV. I joined one and got to know a few other students and attendings, and also volunteered at a free clinic where I was able to meet others. In residency or fellowship, it may be going to dinner with colleagues sometimes. I was in an outside choir a couple times a month, and they were gracious when I missed because of work and call. It's also important to stay in touch with friends outside of medicine. I found this important in medical school and residency, but it's important for all of us. It's important to remind yourself that you can go ahead and call them and use maybe some of the technology to help yourself remember. It's like, oh, hey, I haven't checked in with them in a while. Maybe that would be a great time to do that. And even moving into attending life, it's important to talk to colleagues, whether at clinic, conferences, whether you talk to a mentor, or even if it's just, hey, can I run something by you over lunch? It's important to take opportunities to connect with colleagues, even if it's just making small talk before your section meeting, asking, how are you really doing? And doing that on a more regular basis. It's important to remind yourself and your colleagues that you are more than your productivity targets. You are more than your patient satisfaction scores. You are more than your licensing exam step scores, whether you passed boards on your first try or got honors on that particular rotation. Supporting wellness and fighting burnout and moral injury involves systemic changes, but it also can be mitigated by these human connections and caring for one another. So first, being able to support health at the individual and system levels, then finding opportunities to connect and feel like a human, and 3, flourishing requires opportunities to contribute by doing meaningful work. Many of us went into medicine to help people, myself included, and to make a difference. All those things that ended up on your personal statements for medical school, and yet even through medical school, residency, and attending life, times can be super challenging. And there are lots of temptations to cynicism. I think deep down, we all want to do meaningful work. At least I do. Work that really makes a difference in our patients' lives. The diseases they face, using the skills and training that we've received. Sometimes paperwork and administrative tasks just have to be done. But a few things. First, we need to utilize all parts of our team. We need to reduce the overall administrative burden and streamline some things. And we need to make sure that we are encouraging physicians, empowering them with autonomy and the ability to make changes to help patients, to do special projects or quality improvement that really matters. Some of my meaningful work includes electronic medical record optimization and the civil surgeon opportunity to serve some of my new immigrant families. It may look different for you, but it's all about that intentionality. So take a moment and imagine what it would look like if you were flourishing in the coming year. What steps would you have taken to support your health? More sleep? More exercise? Something else? What connections would you have strengthened or developed? What meaningful work would you have started or taken the next step in? So take those next steps. I want more and more physicians, med students, and healthcare professionals to be flourishing in life and in medicine. Thanks for joining me here on another episode of the MedEd Well podcast. Again, head over to the link in the show notes to get your copy of my Maximize Your Clinical Efficiency PDF guide with 10 tips to get home faster. Check out a White Coat Investor course, especially if you have some of those extra CME funds. Please subscribe, leave a review, and share with another physician or friend to say, hey, these things are important. Wellness is important. Thank you so much for all that you do. Have a great day. And now for our important disclaimer. Dr. Ryan Stejink is a practicing general pediatrician, but the MedEd Well podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEd Well podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEd Well podcast, and have a great day.